A new California bill could open up home ownership opportunities for undocumented immigrants. The bill aims to expand the eligibility for the California Dream for All loan program that's available to first time home buyers. The program offers loans without interest or monthly payments. It's been popular with more than 2,300 applicants in 11 days last year. The last year, the program was first come, first served, but this year it will operate via a lottery system. It also has a new rule which requires applicants to be first generation home buyers. Interested people can submit their applications now. The lottery is slated for April. So, what benefits do new immigrants get in the United States? This was last revised as of March 2024. Supplemental Security Income. So, what is SSI or Supplemental Security Income? SSI provides monthly payments to people with disabilities or older adults who have little or no income or resources. Who can get SSI? Adults and children might be eligible for SSI if they have one, little or no income, and number two, little or no resources, and number three, a disability, blindness, or at the age of 65 or older. Later, they stated, how much could you get from SSI? The maximum monthly SSI payment for 2024 is 943 or an individual and 1,415 for a couple. Your amount may be lowered based on your income, certainly family members' income, your living situation, and other factors. How income affects your payments. For every $2 you earn from work, we reduce the SSI payment by about $1. Work includes a job, self employment, any activity that earns money. For every $1 you get from non working sources, we reduce your SSI payment by about $1. Non work sources include disability benefits, unemployment payments, and pension. If you live with a spouse, their income may affect your payment. Children on SSI who live with their parents may have their payments lowered based on their income or their parents' income. Living with others may affect your payments as well. If you live with someone else or in someone else's home and don't pay your fair share of food and shelter costs, your SSI payment may be lowered by up to $334.33. Extra support from your state. Some states offer an extra payment called a state supplement to help with food or shelter costs. This type of payment won't reduce your SSI. Next, we have Supplemental Nutrition Assistance Program, or SNAP. What is SNAP used for? The Supplemental Nutrition Assistance Program, or SNAP, issues electronic benefits that can be used like cash to purchase food. SNAP helps low income working people, senior citizens, the disabled, and others feed their families. Eligibility and benefit levels are based on household size, income, and other factors. And as below, you have next, we have Temporary Assistance for Needy Families, or TANF. The Temporary Assistance for Needy Families, or TANF, program provides states and territories with flexibility in operating programs designed to help low income families with children achieving economic self sufficiency. States use TANF to fund monthly cash assistance payments to low income families with children, as well as a wide range of services. For example, what is the income limit for TANF in South Carolina? The income threshold for TANF in South Carolina is currently set at 50% of the poverty level. For example, a family of three can earn up to $1,036 a month and still qualify. Next, we have Emergency Medicaid, includes labor and delivery. What is emergency Medicaid for United States citizens? Emergency Medicaid will provide medical payments for care and services only if you need immediate medical attention for a serious health issue. Serious health issues include conditions like a heart attack or severe pain that could lead to a dangerous health outcome without medical help. Next, we have Full Scope Medicaid. Full scope benefits generally provide medical, dental, mental health, vision, and drugs your doctor orders and more. full scope medical, and CMSP benefits are available to individuals who meet all eligibility criteria and are either United States citizens slash nationals or who have satisfactory immigration statuses. Next, we have Children's Health Insurance Program, or CHIP. The Children's Health Insurance Program, or CHIP. If your child needed health coverage, they may be eligible for a Children's Health Insurance Program, or CHIP. CHIP provides low cost health coverage to children and families that earn too much money to qualify for Medicaid. In other states, CHIP covers pregnant women. Each state offers CHIP coverage and works closely with its state Medicaid program to see if your child qualifies and applies for CHIP. Each state program has its own rules about who qualifies for CHIP. You can apply right now, any time of the year, and find out if you qualify. If you applied for Medicaid coverage to your state agency, you'll also find out if your child qualified for CHIP. If they qualify, you won't have to buy an insurance plan to cover them. Next, we have Medicare Premium Free Part A hospitalization. Eligibility is based on work history. Part A hospital insurance cost. Zero for most people because they or a spouse paid Medicare taxes long enough while working, generally at least 10 years. If you get Medicare earlier than the age of 65, you won't pay a Part A premium. Next, we have Premium Buy-in Medicare. Medicare buy-in programs allow people who delay Parts A or B to enroll outside of regular enrollment periods. With these options, certain people with low income can afford to enroll in Medicare. They're also able to free up more of their limited income. Next, we have HUD, public housing, and Section 8 programs. What is Section 8? Section 8 is a federal affordable housing program supervised and funded by the United States Department of Housing and Urban Development, or HUD. It is managed locally by individual public housing agencies, or PHAs, which distribute HUD funding to individual renters and families in need of assistance. Section 8 is also called the Housing Choice Voucher, or HCV program, as eligible low-income families are granted vouchers for approximately 7% of their housing costs, rental, and utilities. The family then pays the remaining 30%. These vouchers are assigned to families directly and are not attached to specific housing units. This means that once a family is issued a voucher, they can use it to rent at any privately owned property as long as the landlord agrees to accept it. What is public housing? Public housing has the same aim as Section 8: provide decent, safe, and sanitary housing at affordable rates for low income families, the elderly, and people with disabilities. However, public housing is owned and operated by the government, local PHAs, rather than by private owners slash landlords. The public housing designation is attached to a specific buildings or units rather than giving to renters individually via a voucher such as Section 8. PHAs make public housing rent affordable to low income families so that rent for tenants can be much lower than market rates. Public housing for low income families is not free. However, families are responsible for the total tenant payment, or TTP, which is an affordable rent price based on the family's annual gross income, or the AGI. Families with children, elderly persons, or members with a disability can qualify for further deductions. Similarities and differences. The Section 8 and public housing programs are easily confused due to their similarities. Number one, both are funded and supervised by HUD. Number two, both are locally managed by public housing agencies, or PHAs. Number three, both aim to help low income families, the elderly, and the people with disabilities. Number four, both determine eligibility based on annual gross income, or AGI, and provide certain deductions slash adjustments. Number five, both use the same HUD income tiers: extremely low income, very low income, and etc. Number six, both require standards of safety and sanitation for the property. Number seven, both have long waiting lists. And number eight, both programs require tenants to pay a certain amount of rent called the total tenant payment, or the TTP. However, despite these similarities, these two programs are not the same, and only one is relevant to private landlords. The following distinctions determine the difference between Section 8 and public housing. Section 8 housing, privately owned, vouchers are assigned to individual tenants/families. Tenants can carry their vouchers with them when they move. Public housing, government owned. Subsidy is attached to a particular housing unit. Family must stay in a designated public housing unit to keep that subsidy. Next, we have Title 20 Block Grants. The Omnibus Reconciliation Act of 1981 amended Title 20 of the Social Security Act, establishing the Social Services Block Grant, or the SSBG. Each year, the federal government allocates funds to the states/territories to support social services for vulnerable children, adults, and families through the SSBG. Next, we have Social Security. They say that Social Security provides retirement income for almost every American worker. We also administer supplemental security income, or SSI, to some individuals 65 and older. People also asked, what is Social Security and how does it work? Social Security replaces a percentage of a worker's pre retirement income based on your lifetime earnings. The amount of your average earnings that Social Security retirement benefits replaces depends on your earnings and when you choose to start benefits. Next, they stated who gets paid Social Security. You can receive Social Security benefits based on your earnings record if you are 62 or older, or a person with a disability or blindness and have enough work credits. This is all I'm saying. It seems to be fairly easy for those who are just getting here to get all the goodies and the benefits that realistically American citizens should automatically have, and especially if they need the assistance, especially if they need the help. I'm not saying that automatically they should be throwing $20,000 directly at you, but if there does come a point in time where you've been working 1 to 2 jobs, or at least one job consistently, and you just so happen to have, fell on hard times, maybe you got laid off, maybe you got fired for whatever unexpected reason, there should be no reason that you, as an American citizen, somebody who has been working, gotten your education, you've been here generationally, there should be no reason why the United States government would not help you. There should be no reason why it is that you have such a hard time trying to get any type of assistance if it comes down to your education, if it comes down to your food, if it comes down to rent or housing or what have you. At no point in time should America not want to help one of its own children, one of its own people, a part of its family, a part of the fabric that has contributed for oh so long and who has worked so hard in order to benefit and make America what it is. Again, when is the last time that the government, you as an American citizen, when is the last time the government has realistically thrown money at you in order to help you, in order to incentivize you to get a better education, to do better, to get a better job? When is the last time that they've realistically ever done anything for you? And in contrast, compare all of the things that they are doing for people who have never been here, who are never born here, who have not contributed to anything, but yet they get every single thing that you need without investing or spending a dime.